I'm Heather Hansen. Welcome to H2 Spark, where we talk about all things health related because we know health glows. I am here at the Zabrecky Institute of Biomedicine with Dr. Zabrecky and Dr. Aggie Hewitt. Dr. George Zabrecky is an absolute phenom in the field of integrative medicine. He has been practicing in this field for 35 years. He is a chiropractor and also has a medical degree. He studied at Oxford and has a degree in immunology from there, as well as a degree in acupuncture. He is a prodigious author and has published and researched in fields as broad as autism, psychiatric disorders, orthopedics, biophysics, hepatitis, optical physics, and a wealth of other information. In addition to all of that, he has worked in this field for 35 years, and the amount of research and the amount of knowledge that he has that we're just going to touch upon today is beyond the pale. I'm also here with Dr. Aggie Hewitt, who works with Dr. Zabrecky here at the Institute. She is an inspiration to me. At 45 years old, she switched careers from a career in marketing and went on to become a doctor. She started as a primary care doctor and then a hospitalist, and then fulfilled her true love, which is integrative medicine. In that regard, she worked with a number of great healers like Dr. Dietrich Klinghardt. Her academic background, though, is in biophysics, and she worked 2 summers at MIT as a research fellow in that field, where she published original research in the Biophysical Journal and the American Journal of Physics. She's also published in Gerontology, Orthopedics, and the Annals of Internal Medicine. This conversation is one that I have been so excited to have for the past few weeks, and I'm so excited to share with you, and we're going to talk about a lot of things that may blow your mind a little bit, but let's get started and talk to Dr. Hewitt and Dr. Zabrecky. Thank you so much for being here with me today.
Well, thank you for asking us.
We're so thrilled to have you here and share this knowledge and make it more public.
Tell me, first of all, tell us, there's so many different words. So we talked about biomedicine. This is the Institute of Biomedicine, but you're also an integrative doctor. And then there's holistic medicine and alternative medicine. Can you tell me what are the differences and what is it that you do?
Certainly, it seems like there's a lot of hats that you have to apply. About 10, 15 years ago, I met my last mentor, professor at Oxford, and he proposed a theory that seemed to resonate with me quite a bit. And that happy place when the body's working in harmony is called homeostasis. And he had devoted his life, full professor at 6 universities. He had a doctor of science, PhD, MD, surgeon, and he came to the conclusion that the only way really to obtain true health is to reestablish homeostasis. So what he did was he did 40 years of research funded by Rockefeller Institute originally and then Foundation later of how to evaluate the mechanisms of how the body regains health after an injury. And I was privy to that with about 200 other doctors at the time. And it really changed my perspective. So whenever we see any type of disorder, the idea is, well, what would the body do? Or what's inhibiting the body to prevent it from recovery? And to aid the body in its restoration, you have a lot of modalities at hand. Certainly acupuncture, and in certain cases surgery, medications, particularly initially. Sometimes that's necessary. But medications aren't the cause for the person's illness. You don't take an aspirin because you're aspirin deficient and you have a headache. So the idea was, well, why is the headache there, and then what's the most conservative way to bring it back to normal? And that's why we needed to have an understanding of the other therapeutic modalities and when to apply them.
I love the idea that you say what's the most conservative way to bring it back to normal, because I think in a lot of people's minds, the things that you do are not the most conservative ways because it's just not what they're accustomed to. But truth be told, the natural ways of healing are far more conservative than some of the medications we're taking, correct?
Absolutely. You can't force the organism to do anything. That's why you have rebound adverse effects. And the adverse effects alone are $300 billion a year in cost.
Wow.
So
that's adverse effects to medications?
The adverse effects where patients have to go back to the hospital, have to have more doctor's visits, that actually keeps the hospitals afloat. It's $300 billion a year.
What types of conditions do you, I think the answer is probably anything, but what types of conditions do you most often treat?
I think it is pretty comprehensive. And we usually see patients, for the first 35 years we saw patients that had failed standard of care. Or they were upset about it, or standard of care had failed and the second line was so toxic they refused it, or there was no standard of care. In many cases, genetic diseases, we can't fix genetic disease in 2016.
Right.
I'm waiting, but it hasn't happened yet. But there's plenty of people doing research. But in the meantime, you can do supportive maneuvers to improve quality of life in those patients as well. But anything that can go wrong that stays wrong in a patient where they miscommunicate, become ill and stay ill, it affects the quality of life, because ultimately that's why a patient comes in. They don't come in when they hear they have a diagnosis of diabetes unless they start having complications. When it affects their quality of life, then they come in.
Do a lot of people come for preventative reasons, or is it really because they're feeling those effects?
Yeah, the pattern that I've recognized over many decades is the initial patient comes in with an illness that's compromising either work or quality of life, and then when they see what's available, they want to bring in family members who really have no symptoms. They just want to be evaluated.
Yeah, and are the family members as open to it as those who have the symptoms?
It depends on their past cultural experiences. You know, if the parents promote it, certainly I hear tons of stories about, oh, grandma gave me these pills when I was a kid. She told me I had to take my vitamins, I had to take cod liver oil. And you see that expressed sometimes not in the children, but in the grandchildren.
How do you diagnose the conditions? I mean, I've looked around here a little bit here at the Institute, and we're going to show the audience a little bit of what this place looks like. But you have a number of modalities that you use to diagnose conditions. Can you tell us a little bit about those?
Certainly. I mean, physical diagnosis, laboratory, I think, are the mainstream, and for standard medicine as well as for what we do. We want to use those to evaluate the status of the patient. So some of them are very high level, like a PET MR. We have one of two in the New England, or the whole eastern seaboard. And that has been instrumental at showing dramatic changes in severe disease over a very short period of time. So rather than doing a 3-year project on Parkinson's, we can really publish in a few weeks, knowing that there's improvement. So that was a huge benefit on the extreme side, and without radiation for the most part. But there's other simple things. People come in, they want to know how fast they're rusting out. You know, how fast, and there's mechanisms to measure aging. You check for DNA, fragments of DNA in the blood. Yeah. In Europe, they call it cell-free DNA. Here, we're a little more sophisticated. In the U.S., we check for fragments of DNA nucleotides, guanosine. So you can take urine samples and say, geez, you're kind of rusting out pretty fast. This is going to catch up with you. Some of those products are associated with neurological disease, some with cardiovascular disease, some with malignancy. And so you get a handle, and if they're high in a well patient that has no existing disease, but the levels remain high, it's waiting to come. And you can actually kind of get an idea of the rate. And those you try to circumvent, and you do that basically by changing diet, lifestyle changes, and supplementation in the beginning.
And these same urine tests, by the way, we can do an isoprostane that looks at cell membrane damage in cells of the brain, very important in concussion, in cognitive disorder. We have urine tests that are so sophisticated that we can pinpoint what the damage is to the brain cells, and then we have treatments that are appropriate to that. We have stool samples that we can test the absorption of your nutrients, what you're deficient in, what you're not absorbing. If you have high fat content in your stool, that's indicative of absorption deficiency. We look for parasites, bacteria, worms. We can look for heavy metal toxicity in the stool. Some of our other tests are like we use a quantitative EEG, which is very sophisticated. You could see a lot in a quantitative EEG.
But what's an EEG?
An electroencephalogram.
So you hook up electrodes to the patient's
brain.
Right.
And they do the typical wave pattern. So you get an EEG, for example, after a seizure.
Right.
Because they want to make sure there's not a mass in the brain that's causing the seizure, or do you just have aberrant wave patterns in that area, which, would suggest a lifetime of epilepsy. So they want to distinguish the cause of a seizure. So an EEG is just little wave-like patterns. It measures delta, alpha, beta, theta waves in the brain. But a quantitative then takes all the wave information summarily and gives you pictures of the brain in different colors. And you can see if the two hemispheres of the brain are symmetrical, which they should be normally. If they're not, you can almost definitively assign either a diagnosis of depression, anxiety, PTSD. So we no longer have to do from the psychiatrist the words,
Yep.
you know, do you perseverate? Are you hypervigilant? Do you have a startle reaction? They're very general questions. With a quantitative EEG, you can definitively start to diagnose psychiatric condition.
I would imagine that the qualitative EEG,
Quantitative
EEG, that it is enormously helpful to the patients, because now it's not just a psychological diagnosis, but it's actual, there is objective evidence of it. Do you find that to be true?
Absolutely. And we started doing QEEGs based out of NYU for autism. And we did a very provocative paper in 2007 about using stem cells in autism. There's a whole section worth discussing on that, but it brought me into a deep area of QEEG with one of the experts in the field, Dr. Linas at NYU. And the QEEG is like an EEG. It checks the electrical patterns on the brain, but it three-dimensionalizes it and colorizes it. And we talked about harmony and homeostasis. The brain, when it resonates, vibrates
Right.
at certain frequencies, everything's happy. This mass communication goes on through it. And when you get a dysrhythmia, it causes an alteration in the way that section of the brain functions. So when you get a tic and your face twitches, or you have ringing in the ears, tinnitus, these are dysrhythmias in the brain. There's no damage.
Right.
It's just a dysrhythmia, and a dysrhythmia can lead to other dysrhythmias, or it can just be chronic and annoyance.
Right.
But the dysrhythmia shows up on a QEEG. Now, we're probably more concerned about the dysrhythmias associated on a greater level, like for insomnia. Chronic insomnia versus other unusual forms of insomnia are caused by a really specific dysrhythmia, and it's pretty much the same in everybody.
Wow.
And so what we do with, we looked for techniques to reestablish normal rhythm. Now, you can't force a normal rhythm back in there, but the body does want to go back to normal. That's what makes us look good. It isn't, we don't fix anything, the body does it. And so when you attenuate that with a biofeedback program or auditory sounds or even physical vibration, it attenuates or eliminates the dysrhythmia and brings it back into normal rhythm, and the symptoms go away. And in some situations, you can take a medication and do it over a cycling period and have the brain go back to normal, and you're fine. You pat the doctor on the back, you feel better. But often it doesn't work. It comes back. The medication produces toxic effects. It's expensive. I mean, I don't talk about Ambien used to cost and what it costs now. But if they have a dysrhythmia, and we've had patients, one patient was taking 4 to 5 times the normal level of medication. In fact, that's another concern. But another doctor said, "Will you please see this patient?" I said, "Absolutely, have him come in." So on the first treatment, we said, "We'll come back and check on you in, what, 20 minutes?" And she went back and checked him 4 minutes, he was out. Totally asleep.
I couldn't wake
The
him
best
up.
sleep he had,
So
right?
that's on the Satori chair, the Therapeutic chair. It's a very sophisticated piece of equipment. The patient lies in an S-shaped chair and has headphones. There are vibrational patterns that come from the chair that synchronize the chakras of energy in the body. Simultaneous to that, you're wearing headphones that have acoustics, so it's some lyrics, it's some sounds of nature, it's vocal sounds, but what they do is they drive the wave pattern in the brain into the delta wave state, which is the deeply meditative state. So the entire body is affected in this chair. With this chair, we can also address PTSD. We lower the hypervigilance in the brain, again, by modulating the different wave patterns in the brain. We can reduce tremors with Parkinson's.
Wow.
There's so much that can be done just with this one piece of equipment. And I don't know anyone in the area who has it, but it's highly effective. So they come here twice a week for the chair if they have chronic insomnia. Then we give them an iPad to take home. They use that for an hour at night again. It puts them into deep delta wave sleep. If they wake up at that god-awful hour of 2 or 3 in the morning, they put the earbuds back in, they're brought right back into a delta wave sleep pattern.
Well, and
And they wake up restored.
And
with restorative sleep.
It reverses the condition. Once you get back into normal cycling, your body wants to stay there.
Right, sure. Homeostasis, as you said.
Exactly.
So is that something that after a period of time they no longer have to sit in the chair?
It's
and do it?
usually
Yeah.
3 months. Within 3 months, they can be cured. The
But-
brain can be retrained. It's
What?
actually plastic.
Oh yeah, it's very plastic.
Yeah.
Now, we've talked about the chair, but let's talk about some of the other treatment modalities. I mean, I know we could go all day about this, but I want to
We
touch
have
upon,
so
I mean,
much. I just
what are your favorites?
my favorites are the IV therapies that we do because people have immediate energy. So if a cancer patient is depleted from their chemotherapy and we give high-dose vitamin C, B vitamins, magnesium, N-acetylcysteine, which is an energy molecule for the body, people come away from it energized. So there's a very immediate gratification
Right.
with doing IVs. If we administer to athletes, we have ultra-marathoners who we can administer before and after a race, and their personal best times drop dramatically getting these IVs. We can use the IVs for so many other things, George. We do peptides for some autoimmune diseases. There's a whole smorgasbord of
Right.
what we use IVs for. So I like them because they act quickly. They build up in your, if you take vitamins,
Right.
10% of them are going to get absorbed through the GI tract. It's not efficient.
Right.
If you dose it into blood plasma, you're increasing plasma concentration and you're pushing chemical reactions very rapidly outside of the cell and into the cell. So you see pretty immediate effects. The other thing that we have is an ozone UBI machine. And ozone is a remarkable molecule. It's 3 oxygen atoms, very unstable, but it can chase down Borrelia, Babesia, the tick-borne diseases,
So let's back up a
viruses like
second.
shingles.
Those 2 diseases are tick-borne like Lyme.
They are,
They're actually, they often go along with Lyme, from what I understand.
and
of those 2.
ehrlichiosis. So, and they're finding new bacteria that the Lyme are propagating in tick bites.
Since we were talking about the Lyme, I think that's important. Is the diagnostics have their own limitations,
Right.
certainly, and in classical medicine, the therapies have massive limitations as well, plus toxicity. So the combination of having limited diagnostic capability as well as improper tools for treating the disease, it really causes havoc on the patients. I wanted to go back to, you mentioned about ozone and UV. These are things that are probably unfamiliar to most people.
Right.
They've separated, and this goes back, I mean, the Germans were using ozone therapy when I learned it 40 years ago, my first trip to Germany, and they still use it. It has a small application, but it's used in infections. And Toronto General, the chief of staff, Rudy Falk, who's now passed, he used to spray ozone on open wounds because it would stop all the bleeding. So it has multiple applications, but anything with oxygen is called oxygen therapy or biooxidative therapy. And at small levels, it has a different effect than at high levels. And we notice this with vitamin C. And we've done publications on vitamin C, particularly in pancreatic cancer. And in the 1970s, when they published out of Mayo Clinic that vitamin C worked in Europe for cancer, so let's try it here. And Linus Pauling spearheaded that twice, and it failed twice. They didn't understand why it worked in England, didn't work here. And it became obvious 40 years later that in England they gave half the patients took it IV. In the United States, same dose. In the United States, they gave it orally.
Yeah.
And it was the kind of the kiss of death for any researcher, particularly NIH, to do anything with vitamin C. And we were supported by a rare individual, Mark Levine at NIH, a senior researcher, that just would not give it up, and took a lot of flack for it. But he recognized the difference, and through several research articles, which we had to do to get the FDA to reestablish this, we showed that the mechanism of vitamin C and how it functioned, and the IV was critical. You couldn't reach the levels necessary by any dose of oral.
Is it a machine that treats these
It's
conditions?
a small machine, and a small amount of blood is withdrawn from the patient, run through the machine where it's ozonated, so it's carried by the red blood cell, the ozone, and O3 is so tiny that the bacteria like Borrelia that cause Lyme disease are shaped like a corkscrew, and they burrow into bone marrow, liver, kidney, your tissues, glands. The ozone can hunt it down because it's such a tiny molecule. So you can eliminate pathogens, shingles, herpes. I've injected ozone into people with massive shingles rashes, and they've cleared within 2 days.
Oh my goodness.
Yeah, botanicals are herbals,
Okay,
and there's just so many facets to this. It seems that certain diseases in certain locales have the local botanicals that can make an influence on it. Although now most bulk botanicals are out of China.
Right.
And we've been there, we purchased our products from there, we do our analysis there and do it here. We have good vendors. When I was younger, we opened up with Dr. David Eisenberg, opened up a botanical library at Harvard. And we did that as a sharing library, so researchers could get vouchers or samples of it to do testing on their applicability. The difficulty in medicine, particularly with Chinese botanicals, is that these are time-honored formulations, and they contain 10, 20 products. Right. And I remember Columbia got a grant of $20 million, and they exhausted it doing the first 11 herbs. And
yeah,
they asked the Chinese physician if he could cut it down a little bit. Right. He believed it would change the activity.
Right, it's got to be perfect, right? There's something to be said for that.
There's a lot of depth to it, so they went to evidence-based rather than science-based.
Right.
Because it doesn't seem to be feasible to figure some of these things out. But the natural products, I think, they in general carry much less toxicity. They're much more familiar,
right.
much more biological
than
the synthetic products.
Right.
And
tell me a little bit about leaky gut. What is it, and what's the treatment?
Okay. I mean, leaky gut is a kind of a colloquial term for intestinal permeability. It's the small intestine becomes, which is a highly absorptive surface. Obviously, we absorb all our food through our intestinal tract. And that's something that most people don't recognize, that 80% of your immune system is in that same area. Right. So it's called the gut-associated lymphoid tissue. It regulates all your immune system. So if you have an autoimmune condition, if you have malignancy, if you have anything where the immune system is somehow aberrant, it's your gut. Your gut is primarily involved. The first metazoan organisms that have more than one cell have a gut tube. I mean, it's the most primordial organ that we have in our system. The nervous system developed from there. All our automatic reflexes, our hormonal system developed from there. So it's a pretty critical integrative organ in the body. If the integrity is breached, and you can do that from changing the ecological environment, so taking an antibiotic to wipe out the flora which covers the intestinal tract lining, or some other type of injury to the intestinal tract, or pieces can get across that shouldn't get across. They're too big. And most of the pieces people think about are food. The food particles are leaking across, and certainly if they get into your bloodstream, they're not totally digested, they look foreign, and you will attack them.
Right.
If you attack them locally, you get irritable bowel, you can have inflammatory conditions in the large intestine, which causes more leakage. And if during the injury, if you're given medications that are anti-inflammatory, they cause more leakage. So a lot of the cascade of events is due to not only lifestyle, diet, but it's also due to medications. And I think the critical factor that people don't think about, and this is one reason it's kind of took time to evaluate this, is that we do see foods leaking across, certainly, but that's not the most common one. What we see is fragments of bacteria leaking across, which are much smaller. And the microbiome, that's a more sophisticated term than gut flora. But I remember being in Europe in the 60s and having lactiol, which was a French probiotic. Right. There was no probiotics anywhere for purchase in the United States. Right. They added sugar to it, but I thought it was interesting that they had it available. But the gut flora communicate with our brain, our gut, our intestine, our heart, our other organs too. They have strains of the microbiome now specifically used to enhance the immune system with ovarian cancer. They have gut strains for colitis and other things that they know that fragments of the organism leaking into the bloodstream actually alter communication in the body. Now, I'm bringing this up because as we get into peptides and other things, it all comes down to miscommunication. All of it. All these diseases come down to miscommunication within the organism that the organism can't adapt to. The gut injury is relatively easy because The gut repairs itself every other day. It sloughs off and regrows.
Oh.
So what do you need to have a cell divide rapidly? Well, you need vitamin A, you need folate, maybe a touch of zinc, some glutamine. So it's well known what you need to have your cells turn over. Nervous cells don't turn over. Now, they're not as flexible for change. That's why they're a little more difficult, quite a bit more difficult to treat. But GI tract issues, they're relatively easy to rectify. But sometimes the gut problems are secondary. They're not the primary issue. There's another problem in the system. It's like in rheumatoid arthritis, is the joint the issue? Well, the joint's certainly where the focus of pain is,
Right.
but it's an autoimmune condition, so the immune system is aberrant. So you really, in fact, the treatments are typically to damage the immune system a little bit so you don't attack your joints.
Oh.
Well, now the damaged immune system leads potentially to other diseases.
Sure. What's the treatment for leaky gut? What should people be doing? What types of things are out there?
I mean, essentially, you want to repair the integrity. One thing we do is we check to see how much of the gut is injured on a mechanical basis versus an immunological basis. A test is available called Serix, which checks for antibodies to the gap junctions, because there's little gaps that open and close in the intestinal tract, which you need. And if there's antibodies directed against those gaps, you know that there's an immunological component already too. So if it's just an injury to the gut, too much antibiotics, you wiped up the flora, there's some leakiness, you reestablish normal flora. Hopefully there's no other pathogen there. Take the nutrients that the gut uses and you can rectify it. In fact, every disease starts out as a simple thing to fix.
Right.
Once that window is closed, you have to become more and more aggressive.
Right.
So some diseases are so well established for so long. That doesn't mean, if somebody comes in and they say, I've been sick for 20 years, but I had a good day last week. It may be easy.
Right.
Or if they come in and they say, I've been sick for a week and I haven't had any reprieve, they may be difficult.
Yeah.
So you listen to the patient's history, and it kind of gives a huge impact on what you're going to do to modify it.
So many people are talking about leaky gut, and when you're on Facebook or on any of the social media, there's so many people sort of expounding their opinions and diet changes and everything. So I think that it's important to recognize people like you who are doing the research and have the information and the research to back up the claims, as opposed to just sort of willy-nilly buying whatever it is that you see on Facebook.
Simple, since the people that you mentioned that are going back and forth and making suggestions and claims, typically the bigger the molecule that leaks across, the more reactive it is. So what's the biggest molecule? Dairy, wheat.
Right.
So it's not that those are bad things, but if you have leaky gut and those leak across, you're going to have a much more profound negative impact.
I see. That makes sense to
So
me.
you eliminate that stuff from your diet. Whether there's all these other fancy diseases associated with lactose intolerance or celiac disease. In fact, if a person never eats wheat, can they ever have celiac disease, genetically or otherwise?
Right.
If you're not eating it, you can't express it. But I think a lot of patients, as soon as you get one injury, it lets you become more susceptible to the other ones.
And maybe more aware of your body too, that you start to feel things that you didn't feel before or think you do.
And I think too, with leaky gut, there's also the psychological component, the amount of permanent damage that can be done to the body just through stress, through a patient's inability to manage stress in their life. So the psychological component is very injurious to the gut as well.
Well, and stress, gosh, it causes inflammation, right? Which is the cause
I
of
saw that
90% of all disease,
is inflammation. Well, at least in
90%.
modern times.
Right.
Modern times. How the body handles things is it either dries up or it gets backed up.
Right.
And most diseases we see are congestive. It backs up, which promotes inflammatory disease. And that's the only way a cell can really die. It either gets polluted on its own waste or it gets dried out because there's no blood supply to it.
Right.
But you mentioned the patients talking about stress and how it plays a role. And I think I saw someplace that you asked about, is all stress bad? And the answer, of course, is no. Stress, jumping into a cold weather or a cold tub, all these things are provocative in the system. And in a healthy individual, they cause the release of chemicals called heat shock proteins that help you adapt to your environment. And I didn't know I was going to go into this, but I looked back on migrations. If you look at human migrations, there's always a large amount of populations that die off, even if they go to a nice area.
Right.
So they populate someplace in southern Italy, a whole bunch died off. They couldn't adapt quickly to the environment because of their genetic background.
Right.
But eventually they adapt and they thrive. Now the migration, same things happen. So we're seeing that happening every day. People can't adapt to their environment. And so that group, genetic group or cultural group perhaps, can't cope with the environment, and they have more chronic illness. And it takes about 3 or 4 generations to adapt to the environment.
How can you teach people to be better adapters?
I think that you answered it already, that they have to be more aware
Right.
of their own body. That's why women are generally better patients.
Mm-hmm.
Men are meant to work until they drop. Okay? Our work is, it's our identity.
Yeah.
So we put a lot of focus on it, where women are more, they put civilization together. They take care of the family, and their self-sacrifice is awesome, especially for us.
Right.
But I think being more aware is a critical factor to it. Because you ask somebody, I've been sick, I can't go to work. Well, how long has this been going on? Well, I guess it started about 5 years ago.
Yeah.
I go, you didn't,
And now you're getting it?
Yeah, now you're getting it.
Yeah.
So, I mean, that could really bring us to the point of what would be the major focal points in your life to help you adapt to your environment, both external to yourself and internally. So, for me, number one, not necessarily the most important, but number one is the food you eat, is what you put in your mouth, is to avoid all GMO foods. The body can't digest them. They wreak
GMO
havoc.
is the genetically
Modified foods. And we're not at a point in the United States where we're labeling genetically modified foods. So, you know, people really have to do their research. So that can be destructive to the gut, and it can infect the entire human organism to ingest food that can't be digested or utilized. The other things to avoid, the obvious, is tobacco, alcohol, processed foods, sugar. You hear this all the time, large portion sizes. You know, you look for the non-GMO foods. The meats should be, you know, free range, farm raised. You know, it's always a good idea to have that local farmer that you can get food from as the environment becomes more contaminated. Mm-hmm. You know, experiments are showing now that Roundup, which is the herbicide used by Monsanto, has so saturated our environment that even organic produce draws from the water table in the ground that is already contaminated.
Okay.
So even organic foods now are questionable. You know, ultimately it would be to take, you know, farm yourself or know a local farmer.
Right.
You know,
Right.
I mean, it may get to that point sometime.
For patients who can't go get IVs, what should they be doing to try to get the vitamin C?
So the most potent form of oral vitamin C is called liposomal, which means the vitamin C molecule is wrapped in tiny fat molecules that help it dissolve rapidly through our cell membranes, which are predominantly fat. So you get larger concentrations that go into the cell. You can get them in, you know, vitamin stores. You can Google. There are labs like Live-On Labs that, you know, ship to you. But that would be the most potent oral form.
Where's the vitamin C going? Why is it so important?
I think it's, I didn't want to get technical, but it's kind of critical to understand where the vitamin C goes. When you take oral vitamin C, your blood levels are very rigidly controlled. And so if you take 2 grams or 10 grams or 25 grams, you'll get to a point where the gut just won't take anymore. Right. And you'll pass it right through, typically as diarrhea, softening stool. What's interesting is if you're sick, you can tolerate 10 to 20 times as much because the body needs it.
Right.
So when you take vitamin C in a healthy individual, what you're using it for is mostly connective tissue development, collagen. And what we really are using high dose of vitamin C for is immune system enhancement and adrenal function. So as the stress level goes up, so does your vitamin C requirement to make adrenal hormones. If you don't take it, then you don't put out the right adrenal hormones and you're not coping with stress, and you need more vitamin C and you get into this vicious cycle. So the dosing, I think what she was discussing before about the vitamin C and the limitation to it, was that as a antioxidant, you can take vitamin C orally and it works fine.
Right.
And that's how it was meant to be taken as a dietary supplement. But at a pro-oxidant level, when you're trying to kill a cancer cell, which has been proven several different ways that vitamin C can do that, you need a pro-oxidant level, and you can't reach those levels orally.
Orally, I see. Now, are you better off? I know in general they say that if you can eat real foods as opposed to taking supplements. So are you better off just in general trying to eat as much of real foods that provide these vitamins?
I think that's the right way to do it.
Yeah.
I think with vitamin C, the acerola cherries were the highest source of it. There's not enough to go around for 100 people.
Right.
So,
That's right. You're fighting over those cherries.
Yeah. So that's not practical. And you talk about stress elimination. So doing techniques that lower the stress in your life or lower the negative impact of stress. I don't think stress is bad. How many people work, they go on vacation, they get sick?
Right.
Okay,
right.
That's because their guard's down because they're on vacation.
Yeah.
That's mismanagement of stress in the body. So the idea is that if you could manage your stress better, you wouldn't have the negative impact, you wouldn't require as much vitamin C.
And what do you recommend for managing the stress better?
I mean, you're bombarded every day. As an adult, pick the right spouse, big deal.
Oh,
we
yeah.
see massive stress in people that pick the wrong spouse.
Wow.
And then, being understanding as a parent that you can only do so much, and the best may not always work out, but you do the best you can, and not concern yourself and grieve about it. I think that does a lot for it. And if you need a method, there's a lot of different ways to do it. The most widely studied is mindfulness meditation.
Right.
And no disrespect to Zen and the other people that developed it, but there's almost any of them work, and you try to find the one that fits for you.
Yeah.
I mean, TM was very popular when I was a young man, and it didn't work for everybody.
Right.
Mindfulness works better for more people. It's something that can be taught and then self-administered, so you don't have to continue doing it. Certainly that dramatically lowers the stress levels, and this goes back to kind of a yin-yang thing where you're just trying to balance your body out and getting the most harmonious situation that you can.
Right. Yeah, it's funny, the first parts, the spouse and the children, so much of it is the story that you tell yourself about what's going on in your life, and if you can sort of change the story, you can change your response to the story and then feel better.
Well, I mean, denial is looked at as something that's bad. Men use denial all the time.
Yeah.
I don't know that there is a negative emotion, but it can be applied negatively.
Right.
So our defense mechanisms are kind of adapted when we're very young, and if we don't mature them, we end up with these adolescent or immature defense mechanisms which don't work as an adult.
Right.
And so we end up at the psychologist's office or in marital distress or financial distress.
Or sick.
Or sick, yeah.
What about exercise? I think that we need to talk about that because I imagine, in my experience, there's a balance there too. Because I know I went overboard and did marathons and all kinds of things, and I think that impacted me negatively. So what do you just think homeostasis there too?
Again, there's a lot genetically. If you're people can be genetically predisposed to do well to compete in ultramarathon for many years. It's a question of your ligaments, your joints, how you hold your shoulders, neck pain, so there's so much involved in doing excessive sports. But to be really in touch with yourself, you have to be physically active. And the more time you can spend outdoors, the better for you. Mm-hmm. So physical activity can take many forms. For some people, it's yoga. It's slowing down the sympathetic nervous system, which in itself can be hyperactivated in our society. It can cause inflammation. It can cause cellular breakdown. So you find that exercise that matches your personality type. For some people, running long distance is the way they talk to God,
right.
And that becomes a meditative state for them. But I wanted to talk about something else too that's very important in how we interact with our environment in protecting ourselves, and that is against electromagnetic radiation, which comes from everything. It comes from the camera. It comes from your cell phone. You're bombarded by electromagnetic radiation. Your nervous system is an electrical circuit. So if you know anything about basic physics, an electrical circuit will be altered in a magnetic field. So you're getting high-powered electromagnetic field from hair blow dryers. You're holding that blow dryer close to the brain. It's generating a large electromagnetic field. Your cell phone very close to your head, and the evidence of glioblastomas now on the sides that people hold their cell phones. Your microwaves, your radios, televisions, everything should have gadgets on them that neutralize or minimize electromagnetic radiation.
So there's
Because
something you can buy to put on these things that's going to take away the negative effects of
There are
it?
quite a few companies that have made tiny little stick-on gadgets that you put like on the back of a cell phone, on the back of your laptop. I have it on my blow dryer, my router. It goes everywhere where a field is generated, because in an electromagnetic field, everything is affected, even the optic nerve. Your optic nerve fires differently when it's under the influence of an electromagnetic field.
And they're actually developing a documented diagnostic test just using the optic nerve.
Oh, wow.
They're doing it at Jefferson,
Wow.
neo-ophthalmology. One thing I want to mention too, just to bring it back, is that when you look at people that are sensitive to electromagnetic energy, it's a niche group, and it's larger and larger and larger as time goes on, but it's the same thing as the migration.
I was
These
just gonna
things haven't
say,
changed.
the
That's what I wanted to get
adaptation.
across.
Yeah, so eventually it may be that we adapt to, because these
The ones that can.
Right, the ones that can, the rest of us are just croak.
And that's acceptable to development of
Right.
our lifestyle.
Yeah, or prevent it by sort of adjusting and using some of these various little
It's
gadgets.
such a small effort to make for
Right.
such a large effect.
Yeah, I know, and this is something that we've talked about before, like lights before bed and all of these things. You don't realize what an impact all of these conveniences.
Yeah,
Even
yeah.
just the blue LED light completely halts serotonin and melatonin production instantly the minute your eyes are exposed to blue LED light. So this is such a phenomenal amount of information that the average person with very little time, how do they access this? So Dr. Joe Mercola is a great website.
Right.
I would recommend everyone tap into him. He gives you in brief structure everything that you need to know. He's up to date on everything. So he probably gets 3 million hits a day on his website.
Yeah, I
And
looked at that last night.
he informs you of everything.
And he's open to, I mean, if it comes from him, I've seen him to be extremely consistent and truthful. If he has a guest speaker on, sometimes you'll see some bias in that, but anything that he published, he's just that kind of a person. I think it's a great website.
Well, and it's just the more you know, the better you can do. You don't have to go all in. One thing I do want to ask you about, though, because if you are under the belief that your beliefs create your reality, is there some danger in believing that everything is dangerous? That so many things are dangerous? Does that open you up?
Of course. I mean, how can
Yeah,
you live?
That becomes a stressor then.
Right, exactly. So how do you handle that?
That becomes a stressor. You inform yourself and you do the best you can.
And then just let the rest go.
Yeah.
And at some point you have to trust, you
Right.
know.
Greater power.
Even
you
though,
have to trust
yes.
in that
Yeah.
power.
Columbia did a study, it's called the Holmes Well Questionnaire, a long time ago, 25,000 questions. And what they were seeing was, they were looking at a lot of different things, but the part I was interested in was longevity. And when they asked patients who were very, very old, all over 100 years old, and that was a small group,
Right.
but they asked them, and the only things they have in common, it was that they could handle loss, which was the second thing. They had all lost friends multiple times, lost their spouses, sometimes lost their children, and they didn't die from it.
Right.
And they believed in something greater than themselves.
Yeah.
And so I thought that was kind of interesting. And Dr. Newberg, my colleague at Jefferson, he's spent his life's work on doing imaging, PET imaging, after prayer and after meditation, after mindfulness programs. And the alteration that takes place in the brain is just beyond belief. And it's supportive.
When I was a medical student, I did my emergency medicine rotation at Temple. So Temple is sort of near the inner city in North Philly, in Philadelphia. And once in a while we'd have the older women come in who were 104, 106. And of course, I grabbed them, sat down with them, and said, "What is the secret?" And they would say, "Dr. Hewitt, I eat fried chicken. I make fried chicken for my children and my grandchildren. I've worked as a house cleaner for my entire life. I raised my grandchildren, but I have faith in the Lord.
Yeah.
The faith in the Lord is what carries me." So And I would say, have you ever had a vitamin? Never had a vitamin, Dr.
No.
Hewitt.
Vitamin
but
prayer.
I have faith in the Lord.
Yeah.
So I really want to say from a feminine, more of a feminine point of view about well-being is that of avoiding toxic relationships, of forgiving instantly, of having a wide social network, individuals and groups that you relate to. Giving back to your community, to me, is something that gives you so much positive energy. It's immeasurable what that does to your health. You feed the homeless, you work for Habitat for Humanity, you volunteer with Goodwill. Giving back in any form, what that does for the well-being is indefinable.
And there's, again, there's studies that show that, but what you two are doing for the medical field and for the community here at Villanova, I cannot be more excited to have you here and to have these resources here. And I know I'm going to be coming back and picking your brain again. And I want to thank you so much for your time today.
Oh, you're
really,
very
really
welcome.
It was
appreciate
such
Enjoyed
a
it.
pleasure. It was
My
really
pleasure.
wonderful. Thank you.
Thank you.
Next time, bring donuts.